My name is Noah Tapaua. I'm from New Island province, and I'm a qualified cardiothoracic surgeon working at the Port Moresby General Hospital. I did all my training in our university, University of Papua New Guinea, and then I spent sometimes 2 years in Melbourne doing cardiothoracic surgery, and I also spent 2 years in Singapore. And after returning from those two institutions, I've been here ever since. I'm currently the surgical coordinator of the surgical department in the hospital, and I'm the cardiac committee chairman and also a deputy chairman for the Operation Open Heart Foundation. And of course, I'm a cardiothoracic specialist. Cardiothoracic surgery, it basically is a specialist field in surgery that we deal with. The thoracic is the chest, and of course the cardiac is in the chest. So the other structures, the other organs in the chest are the food pipe, the esophagus, and the windpipe, the trachea and the lungs. So that's my specialty area. Just like any other country, in Papua New Guinea we have the congenital heart disease, and then the acquired, and of course the lifestyle heart disease. In every population we will have 8 per 1,000 children with congenital heart disease. These are children who are born with problems, structural heart disease. During the development, the heart does not develop properly. There are some defects or holes that they are born with. So 8 in every 1,000 children, you will have it. And it's constant everywhere, same. And in PNG, same. The acquired group is the rheumatic heart disease, and this is mainly due to poor hygiene, especially when the children are growing up. They have some recurrent chest infection, and the body develop, immune reaction to fight this bacteria, and Streptococcus is one of the common bacteria that cause respiratory disease. And apart from killing the bug, the body develops immune reaction to fight that disease. But apart from attacking only the bacteria, it also affects the body, under the joints, and the heart itself. And then it destroys the valves. So this is another group that we see in a good number of them. And then the congenital are the communicable, non-communicable diseases, heart disease. The first coronary artery disease that is recorded in Papua New Guinea was in 1964. And we would see maybe 1 in 3 months or 4 months that will come to the hospital. Today, every day, we are seeing patients with coronary artery disease. And it's a teamwork in surgery. You have the nursing team, you have the anesthetic team. These are the team that will put the patient to sleep before we operate. Perfusionists, they are the ones who control the machine, because we have to stop the heart to operate. It's like a car engine. The mechanic has to stop the heart engine to operate. So it's similar to the heart body. It's one of the organs that it's a very complex organ, and to work on it, we have to be very meticulous and very fast to fix it. One of the main challenges is setting up this unit, surgical unit, because as I alluded to, it's not only the one patient surgeon. It comprises of these various groups. So I have to have a specialist cardiac nurses trained to do that operation, specialist anesthetic to put the patient to sleep, specialist perfusionist to run the machine, and of course our surgeons. So for us to train as individual is very challenging, because you cannot train one at a time. It will take a long years. We have to train as a team, as a group. So that's one big challenge. And when you train them, coming back, it's very difficult for us at the moment, because our structure, I would say like DPM, it's mainly public medical personnel. we have not started creating any specialist positions. So that's one of our big challenges. Where do we put them when they come in? That's one thing. The other thing is the space, okay? The operating theater. At the moment, we are all doing these surgical operations in the same 4 operating theater in the Port Moresby General Hospital. Over the years, the operating theaters in the hospital have never changed. That is our bottleneck. And I'm thankful to the government of the day, Mr. Marape and Rosso, and Kumul has come on board to build us a new operating theater complex. We are hoping by probably end of next year, we should have a complex and start providing this eye specialty for our people. Educating the public is very, very important. Targeting the children at school, running such program, making awareness of lifestyle diseases. The lifestyle diseases is something that we are careless. Our body, it's like you are putting in a fuel. The food is fuel. You have to run the body with fuel, and that is the food. And our body, if you look at it, it was designed to live with the plant-based diet, but we have changed it to a protein, and this food that we are eating is full of salt, is full of sugar and fat. So we are feeding our body with this fuel, which is contaminated already, and we will start getting sick by the time we reach the age of 50, 60, 70. It's like you're putting petrol into a diesel engine. The car won't stop suddenly. It will run down the distance, some distance, and then it will stop. Our body is like that. So the lifestyle disease starts when we are young, what we are putting into our body. If you are smoking, I would advise you stop. If you are drinking alcohol, you stop. If you are eating a lot of this high sugar diet and salt and fat, these are food that will promote diabetes, that will promote hypertension, and eventually lead to heart disease. And coronary artery disease is what we are now seeing. Like I said, we are seeing every day patients are coming in with heart attack. And there's another group that comes in with rhythm problem. The heart rate go bizarre. And this is another group that we put in a pacemaker that will bring your heart rate back to 60 and above. So a lot of heart problem, that will cause if we don't look after our body, we don't put in the right fuel. The plant-based diet contains a lot of chemicals that protects us. And in medicine, we call it the phytochemicals. These are the chemicals that helps our immune system to fight the diseases. And if we don't have it, and we're putting in the high salt, high fat, and high sugar, we won't help our body to fight the diseases. The message to get out to the public is, if you are feeling sick, whatever it is, go to the nearest hospital or clinic and get checked. All the doctors are aware that we are all trained to detect and make diagnosis of various diseases, and then they can direct you to a specialist like us in Port Moresby General Hospital, and then we do further investigation. And once we arrive at a diagnosis, then we give you the treatment that you require.